Has audio, right?
Yes.
Okay. All right.
Did it go digitally?
Yeah, it says it's recording. Okay. So no pain. There'll be no.
All right. This would be a normal indication. Look, Legend's looking pretty good down through the withers. You'll probably be able to notice the difference when we get down to the pelvic area because Legend's having a good bit of pain down in the low back and also in the pelvis. Now we're starting to get some reflex.
Oh yeah. Okay.
So good bit of positive response in the low back and pelvis. And as soon as we palpate, we get past the last rib, feeling pretty good in the saddle area, but as soon as we get past the last rib into the low back area is where we get into the pain.
Right, where he's flinching, yeah.
So that's from the pelvis. This is the pelvis here. All the way to there is pelvis. So having a pretty significant pelvic issue. Is giving him a good bit of pain.
Right, yeah.
A lot of restriction when he walks out.
Do you feel it more on the right or left side, or is it both sides?
It's on both sides. I haven't evaluated the other side that much, but we'll check his ribs while we're here.
Okay. Remember Wolfie used to get ribs out, and I mean that was really painful for him.
Yeah. Gives them some breathing problems because it makes it uncomfortable for them to have full respiration. So we can see the last ribs being pulled by some of the musculature of the pelvis. This twitching that's going on in the last ribs is from the pelvis drawing the ribs away. So that's all part of the same problem.
Okay.
But this is more of a normal response, what we would expect in the ribs. And I can check the ribs in two different planes, one in inhalation, one in exhalation, because they can misalign in either phase.
Oh, okay.
So as we get back toward the 17th and 18th rib, the last two pairs of ribs, is where we're getting that paniculus response. So
poor baby.
The pelvis is pulling those last two ribs.
Oh.
We're going to check his knees and see if he's front loading to his knees.
Okay.
Check his forward extremity. His elbow. His shoulder. Pretty tight up in the shoulder blade.
Yeah.
Probably from front loading from that, taking some of the weight off behind. Now sometimes when the knees go out, it makes kind of a loud noise when it goes back in.
Is that him grunting?
That's probably knee grunting.
Oh, okay. Have you lift the lifting? Okay, yeah.
Can that make them be more on the forehand?
Well, the pelvic problem will make them more on the forehand. That's what pulls the knees out.
And then they're lame up front.
Right, because normally the horse will carry 60 to 65% of the body weight up front. When the pelvis goes out, they'll transfer another 10 to 15% forward, which eventually gives them front end problems because they're not designed to carry that kind of weight up front. So we've been checking for suppleness of the neck and poll, which is doing pretty well. Most of the issues are in the hind that I'm finding.
Okay.
Pretty supple with the neck.
Isn't he sweet?
Very cooperative patient.
Yeah, he's really, I mean, a wonderful horse.
He says, I really want to be well.
I know, poor Ledge.
I don't like this.
He's been through the mill. He was literally limping and wouldn't put weight on one leg about a week ago.
Well, he has pretty good range of motion in the paw. That's a nice colored halter for you. That's very nice.
Yeah, it does. It makes his face pop.
So he has good range of motion in the neck and paw both ways.
Okay.
So I like what's going on the pointy end. So you can see when we come down along palpating the spine, as soon as we get past this last rib, we've got some of the deep muscle attachments, some of the deep psoas muscle from the pelvis attaching along the spine here. As soon as we get past this last rib, we can start seeing some of the pain.
Yeah.
Dropping down into, and this is all from this pelvis. So, and even the external abdominal oblique muscle and the flank muscles are uncomfortable too as a result of that pelvis issue.
So a good massage after his adjustment would help him a lot too.
Oh yeah. Probably like spa day.
I know, I could put a little clay mask on him and a shower cap, you know. I have a fabulous mask that's great for cleansing pores. And
So I'm going to test it on this side too. Again, we're testing the spine to see we saw what we did on the other side. We get, again, off of this last rib, now we're in the lumbar spine or the lower back. We're starting to see the positive response is taking place.
I see Vanna's talking to you because she hears the clicker. And she's like, Lance, is that you? Hey, I'm here. I don't know if you know, but I am available.
That's what I like about it.
I know, because all the horses talk to you when you come back.
So I think the primary pelvic issue is the right hind and is transferring a good bit of weight to this left shoulder, making it pretty sore in the shoulder. So I'm thinking this is pretty much secondary to what's going on back there.
Okay. Poor thing. Look at him flinch. Poor baby.
A little different reaction than we had on the other side, right?
Yeah.
Well, the pelvis being the largest bone structure, whenever it goes out, it dominates everything else, so the whole rest of the body is attempting to compensate for that and adapt.
Do you see it as being a flexion or a locked and extension thing?
Extension.
Extension, okay.
Extension. Just because of the pain pattern, we can walk him out and confirm that. The pain pattern is pretty characteristic of extension, being locked in extension,
Okay.
which is the bucked out position.
Do you want a lead rope?
Sure.
Okay. Yes, please.
Yes. Oh, okay.
Okay, I'm going to